We will start in 5 minutes, ma'am. Okay. You can share your screen, ma'am.
1 minute. Share screen. Okay.
Yeah, it is visible.
Mute already.
Hello, ma'am. Can we start, ma'am? Anjali, ma'am. Hello.
Yeah, yeah. Yes. Hello.
So,
Yes.
yeah, ma'am.
Hello.
Can you hear me, ma'am? Can we start?
Yeah, 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 doctor. Yeah.
Okay. So, good evening, all. Today, this week is our last week of Excel Season 2 webinar series, and we have a young an experienced doctor, Dr. Anjali Balkrishna. She has been came here last month. So, without much wasting time, we will start the session with a silent prayer. Thank you. I will introduce for those who haven't heard about ma'am. I will give a just brief introduction regarding ma'am. Dr. Anjali Balkrishna, a homeopathic doctor practicing for 20 years. She has completed her PG classical homeopathy degrees under Professor George Vidolkas. She is also a nutritionist, holds a diploma in nutrition at Stanford. She is a qualified yoga therapist and has completed various yoga courses from different universities. YAC from Bangalore, YTC from Nasik, and PG and MSc from Tamil Nadu. She has written an article on ADD, ADHD, and autism with yogic intervention in the upcoming IHRC book, and also conducted webinars on the same subject to help with yoga intervention. And also a webinar on homeopathic treatment in skin diseases with yogic intervention associated with the Bhargava Phyto Lab. And she is associated with the Alpha to Omega School of for Special Children to impart homeopathy and yoga therapy. Also associated with the Agam Foundation in an NGO in Chennai as a homeopathy consultant to conduct camps and training in homeopathy for general awareness. Her other interests are Bharatanatyam and singing. So I welcome you, Ma, for taking this session once again. And with due respect, HMA Piravam, welcome all the delegates who joined us in YouTube, Facebook, and Zoom. Thank you all. Ma'am, you can take the session.
Thank you, Dr. Deepu HMA Kerala. You have given me again second chance to uh, give my knowledge to all these who are participated here. Thank you so much. So my topic is today hormonal changes. So how we have to manage with homeopathic treatment and yoga therapy. A big topic actually. It's very deep topic, hormone. But okay, I will, as much as possible, I have to explain about hormone in 1 hour. Correct, Dr. Deepu?
No problem, ma'am. You can take the max whatever time. Okay, no problem.
Okay.
Okay.
Yeah. Okay.
Okay.
So
Dr.
yeah.
Rekha will be there, and there are so many people there, so no problem.
Oh, okay. Yeah. Thank you, Dr. Rekha. Hello. Okay. So hormone. What is hormone? See, normally when people think about hormones, they probably think of the most commonly male and female hormones, so testosterone and estrogen. Children also, as well as adults, produce many other kinds of hormones that affect every aspect of their health. Many of them they knew about hormone. What is mean by hormone? It's a chemical reaction that cells and body parts to do certain things. See how he that hormone uh, works. Okay, to means he will tell the cells, he will tell body parts to do certain things, and how we, because of our other things, how we imbalances our hormones, that we wanted to see now. So these hormones travel to other cells and help control or coordinate many body processes, such as our moods, growth, development, tissue function, metabolism, as well as sexual function and reproductive processes. Therefore, if hormones did not exist, your bones would not get the message that it's time for you to grow and get bigger, or know when it's time to begin puberty. So, what is mean by hormone? So, it's a chemical and that tells cells and body parts to do certain things. So, how we disturb this hormone and how we think about hormones, how to balance hormones again. So, already that hormonal process when it starts in puberty, adolescence, and menopausal thing, that I wanted to explain you. So, how many hormones in our body parts? See, this is a hormonal things. Hypothalamus secretes dopamine, vasopressin, GnRH, pineal gland, melatonin hormone, pituitary gland, gonadotrophin hormone, TSH, prolactin, oxytocin, vasopressin, liver. Everybody knows how liver, IGF, THPO. These are the chemicals they secretes. Thyroid gland, now I think 70-80% people they know about thyroid. Many of them are suffering also. So what hormone they secrete? T3 T4 calcitonin. Adrenal gland, that androgens. adrenaline, non-adrenaline, kidney, calcitrol, renin, testes, androgens, estrogen, inhibin, ovaries, estrogens, progesterone, uterus, prolactin, pancreas, insulin, and glucagon, stomach, gastrin, ghrelin, histamine, somatostatin, and neuropeptide. Thymus also, see thymopoietin. So these are the hormones, these are the chemical reactions. Every organ of the body, every endocrine gland secretes these chemicals. So why they get disturbed and how we behave psychologically, pathologically, physiologically, what changes happens, that we wanted to see now. The endocrine glands are the body's main hormone produces non-endocrine organs such as brain, heart, lung. Just we saw that pancreas, liver, thymus. If hormones are not released properly or produced in excess, symptoms such as obesity, growth failure, muscle weakness, acne, high blood pressure, psychological changes may take years to develop. Depending on the specific cause, doctors may treat their condition with homeopathic medications. Yoga therapists treat with yogic treatment, so with including diet thing. A conventional treatment is like replacement hormones or medical procedures to regulate hormone levels. So physical changes when it begins as early as 8 years and as late as 13 in girls, and between ages 9 and 14 for boys. So what happens during that age, and how to deal with those children who is having this kind of hormonal changes, what we can see very observately and thoroughly also. So hormonal changes, how it in during puberty. See, actually, every time we think about girls, girls will experience more than boys, but boys also will experience a range of emotions. Okay, when that's puberty time, the time they feel irritable, sad, even depressed. They may feel different emotions related to their sexuality, including desire, confusion, fear. So parents, they should understand why my child is getting irritated, why my child is getting nervous, why he is having mood swings, why he is not telling openly, why he is not talking, why he is talking so anxietically. So emotions may become stronger and more intense also. So that mood might change more frequently, but that strong emotions that they have never experienced even before. So sometimes these boys, they don't cry, they don't express their thinking, feeling very conscious. They are having peer pressure, so many conflicting thoughts, mood swings. So we need to understand that why my this boy is doing like this suddenly. Till 9 years he was not like this. After 9 years, 10, 11, like we can say sixth standard, seventh standard, he's changing again and again. He's showing something different moods, even some kind of emotional things. So same with the girls also. So girls will experience a storm like emotions. So they go through puberty when they go through. So that experiences that premenstrual syndrome, that is anxiety, irritability. Sometimes some girls, they are having sleeplessness, sadness. Why this is this? So many thoughts were repeatedly coming to their mind, and they some children, they don't open it. They will show with the irritation, they'll show with the anger, because physical changes as well as whatever physical changes are happening with them, they are not able to accept those things also, and they're feeling something different, and they want some kind of friendship with the parent, and exactly opposite parents. Some parents, they behave very rudely. They're telling, no, you don't talk like this, you just. So they'll give lecture only, so that lecture also they get bored. So understanding what is happening to her or his body, mind can make your daughter's or son's transition period from girl to woman or man a positive one. So how it will be? Okay, so this is the puberty. Now, what changes happens like endocrine system? So whenever they're talking, whenever they're coming to that age, 9 to 14 years in that age, so much chemistry will be there inside the brain, inside the body, going on haywire. Not all the children they suffer. Very few children they'll go very smooth path, kind of thing. But nowadays, because of our you cannot say bad habit, but it's everything has changed for these children also. They don't have time to mingle with social things. They don't have time with the talking freely with their parents. The parents also don't have time to talk with them. So many things are also there. They are having a lot of competition, school pressure, peer pressure. So big, so very earlier stage, their chemical imbalances starts happening. So what happens with that? See, hypothalamus, like as I told, how hypothalamus regulates their heart rate, blood pressure. So very small age, like a 8th standard, 9th standard children are telling, I'm having palpitation, I'm having unknown fear. So we need to understand why this child is having. We have to make a friendship and ask them why, instead of telling to shut up their things. So what happens during adrenaline? See, adrenaline also sometimes if it imbalances, what happens? See, non-adrenaline and adrenaline, same like a heart rate increases. They think they complain about their even eyes problems also. They always will dilate their eyes. They will just contraction, relaxation all the time. They will do with the eyes. So we'll tell them, no, 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 you don't do like this. You don't touch your hairs. You don't do with your eyes anything. You just calm. So but it's not they also don't want, they also wanted to overcome those things, but they don't understand what is happening inside the body. So we need to explain then what is happening in that. So what is the role of oxytocin? So what oxytocin, many WhatsApp messages used to come, I think 6 7 months before. So oxytocin means when you are close to another person, like giving happiness, positivity to each other, oxytocin releases. So so those kind of things we need to understand, and we need to tell children also. So serotonin, all the time we are listening about serotonin. Serotonin, what serotonin does, it's a big role of the serotonin. It's affected by see how it is very nice thing actually. This chemical serotonin, this balances with the exercise all the hormones, okay, but serotonin is a beautiful hormone actually. He is the guard of all the hormones, you can say. If serotonin disturbs, all the hormones will make a this means all the hormones will make we won't make friendship with any other hormones. So they'll just go haywire. So everybody will disturb because of this serotonin. So serotonin regulate our mood balance, so sleep cycle, and even digestion, metabolism also. See, that is why I told, see, serotonin disturbs means all the hormones will go imbalancing. So this is the our chemistry inside the body. So what happens? See, these are the puberty level. These puberty level children, they are carrying with the adults. And how it will become? If they don't understand that time what is happening with them, so that anxiety, that irritation, that anger, they will carry with the adolescent age. So adolescent is a period of life with specific health, developmental needs and rights. So it's a time to actually develop knowledge, skill, learn to manage emotion, relationship, acquire attributes, abilities will be important for enjoying the adolescent year and assuming adult roles. So we tell, no, you now you are becoming, you are growing. So you just behave like this. Means what? So it's a time of many psychological, physiological changes. So whichever it happened in 9 to 14 years, yeah, 13, 13 years. So how it goes forward to them. See, like adolescence is a significant shift in hypothalamic, pituitary, and adrenaline. So what I told, hypothalamus, what is the role of hypothalamus? It gives a When you are so much anxiety and angry and irritable, so your heart rate will increase, unknown fear will start. So what pituitary does? Actually, pituitary should control that, but hypothalamus is in that not in balance condition, so pituitary also won't help. So if pituitary won't help, so that anger will become violent. So then adrenaline will. So how it affects? So HPA axis reactivity we call. So resulting what happens? Results in heightened stress induced hormones. So more stress, more anxiety creates. So adolescent stress means what? It's a big issue, important issue. The early teen years are marked by rapid changes, physical, cognitive, emotional. Young people may face other challenges, including changing relationship with peers, new demands at school, family tensions, safety issues. Nowadays, so we are listening in the newspapers, news channels, so many things. So already parents are also so much anxiety, so insecure they are feeling. They are not able to send their children with the group, with auto, so many things. So children are also carrying those kind of fears. So very earlier stage. So that is why hormones are disturbing. We are disturbing hormones. So teen hormones affects again moods, emotion, impulses. So mood swings will be often. So these experiences are caused by the estrogen, progesterone, and testosterone entering inside the body at adolescent age. So neurotransmitter, what I showed you, neurotransmitters. These are all neurotransmitter. What they do, that serotonin, dopamine, cortisol, all they often affect emotions. So emotion is generally a driving force behind positive or negative emotion. So whatever we are thinking, whichever our 9 to 14 years, what we have suffered, what we have carried, which kind of anxiety, which kind of positive, negative thoughts, how we will take in a adolescent age. So adolescent age is the really important age. So that time they need to understand what to do in their life. And but if they don't understand, if they carried all their whatever it happened in 9 to 14, so what happens? So we call that roots of the 9 to 14 is the root age. So what roots, what soil you are giving that root, so your child will grow according to that. So if you are giving spiritual abuse, physical abuse, spiritual abuse means many people, many houses are having, they need to do that, they have to complete that, then they have to go ahead. So many things, so many rules, regulations. So their interest will go off. So we call abuse because it's not a simple thing to overcome those things. So they feel fear, physical abuse. Now we are listening, so many things are happening outside. So that physical abuse. So they feel loneliness. Then because of that, always they feel sad. They get angry. So emotional abuse also will be there because of those things. That emotional abuse, sexual abuse, it is all interrelated. Then hereditary factor in that, so many other disorders also comes, like from anxiety to any psychological disorder, anxiety, OCD, so many things will come. So what your child will become, where this child will go, if he is carrying this kind of roots, and if you are giving this kind of soil, nutrients we call, so this kind of nutrients, if you are giving means your child will go in the alcohol, drugs, religion. So all the time that the gambling. So they'll cheat people. So positive hormones are not there at all because he's carrying all the time this and he has imbalanced all the hormones, and so that is why he started suffering with those things. He likes or not like, no choice here. But how we grown up our children, how we grown up, according to that, our branches, our tree will become. So that is why tree also become dry only. So same thing, even here, if instead of that, if you give this kind of roots, soil, nutrients we call, positive thoughts, natural food, stronger immunity thing, regular exercise, if you tell them to do, meditation, some kind of, see, like a spiritual abuse is different, because if you're giving some kind of particular time, particular rule, you need to do, means do this. No, these children, they don't want like this. They don't like. So because already they are going with a lot of changes, physiological, psychological. So we need to understand and we need to tell them to go with that. So balanced diet, healthy lifestyle, healthy eating. So what happens at, obviously their tree will grow very beautifully. So that is a, they feel relaxed in their life, energetic, smiling. So oxytocin will create. So positive energy will create. So they will supply, you can say. So these are all the positive tree. So beauty, happiness. So even physically, mentally, and psychologically, they'll become positive and they will produce oxytocin more. Okay, so oxytocin gives a positivity. So see how it comes, puberty, then adolescent age, and now we are going to the menopause stage. So see how it carries that one only anxiety if you take, either fear if you take. See, if you take 9 to 14 in that anxiety, lot of anxiety if your child is carrying. So if there only, if you tell them to go with this kind of roots and this kind of minerals, and if you just talk about meditation, regular exercises, diet, how should be, what kind of diet he has to eat, positive thoughts, what is mean by, if you tell them that time, so your adolescent age will be like this. But everything will go haywire if you are, that these children will go in addictions. So then ultimately how it will be the menopause or andropause. So so that third stage will be the menopause or andropause. In the menopause in the ladies, andropause in the gents, that is males. So in that menopause also four stages are there: pre-menopause, perimenopause, menopause itself, and post-menopause. Just they suffer with that. See that anxiety, if you cut in that stage only, and how to deal with that anxiety, if you teach them, so their adolescent age also will go happily. If that also doesn't go happily, so that hereditary factor, if it is there also, they could overcome because of your positive thoughts, because of your understanding, because of your teaching method. So but it will carry with the menopause, because once your hormones imbalances in 9 to 14, they are not able to cope up in adolescent age. But if there also you are not able to do anything, if you are not telling anything to do with the medicine, with the any yoga therapy, any exercises, if you are not able to tell your child in adolescent age also, so how it goes menopause level. So what menopause, in that during menopause happens, premenopause means the first sign of menopause. So just its starting factor, you can say that, like all hot flushes, anxiety, mood swings will start little. That means that puberty time only during period used to be there. Adolescent age, they're actually just enjoying life and understanding the society. That stage also they suffered with the in a month 20 days. But now in menopause, all the time they are having mood swings. It is not only during period, before period, nothing is like this. So perimenopause second stage means estrogen level begins to decline and fluctuate, causing unpredictable period. Anytime it comes. So that throughout 30 days, don't know, they are very sensitive. Sometimes they are very brave. They behave like like a brave. Very then they sometimes they cry. So many kind of fluctuations will be there. Hot flushes, dry skin. So this is a perimenopause. Then that is we can call premature menopause. Then menopause itself. What is menopause? So it is the end stage of natural transition in a woman's reproductive life. Ovaries stop producing eggs and women can no longer get pregnant naturally. So it is a marked by the total cessation of the menstrual cycle. So estrogen will stop. See, estrogen started during adolescent age. Estrogen, testosterone. So it was giving lot of thinking and lot of happiness in their life. So it stops. Then post menopause. After menopause, what happens? Due to decrease in estrogen, there is increased risk of osteoporosis, heart disease, immunity level also. Sometimes some ladies are suffering now. Okay, immunity level also they are feeling going down. So it's a last stage. Same with the males also. We call andropause. What happens commonly? Common symptom will be diminished libido, reduced lean body mass, erectile dysfunction, osteoporosis, even them also, hot flushes of even them also, impotency, increase in visceral fat, that is abdominal fat. Why it happens in there? Like here, estrogen will stop, decrease, either stop. So here andropause. So causes of andropause is what? Hypothalamic sensitivity will loss. Testicular defects will start. Increased SHBG level. Then circadian rhythm dysfunction. What is circadian rhythm dysfunction? So stress, diet, and disturbance of the sleep-wake cycle. That is, we call a lifestyle disorder. So these are the disturbance. So this dysfunction creates a testosterone production less. So dramatic shift to the circadian rhythm of testosterone production. Increased SHBG level means SHBG level with the age and albumin level decrease with age. So what will be the result? So that is a bioavailable testosterone will be declined. So testicular defect. So during this aging, concurrent decreased leading cell LEY leading cells response to LH. So it is likely due to desensitization of sex hormones receptors. So due to prolonged hyperstimulation by chronically elevated levels of LH and FSH. So this loss of hypothalamic sensitivity. So hypothalamic sensitivity loss means it's very progressively, like just I told HPA. So same thing here also, hypothalamic pituitary testis axis. Okay, so here HPT, that activity, that reactivity which leads to the progressive loss of hypothalamic sensitivity. So common symptoms with the menopause and andropause is what? Mood swings, depression, headaches, night sweats, insomnia, weight gain, and bone loss. In this is the things when hormonal started imbalancing. Hormonal hormones are getting decline. Hormones are going to stop and separate. Like a males will suffer with decreased motivation, lack of focus, low energy, muscle loss, mild to moderate erectile dysfunction. With the ladies, forgetfulness, hot flushes, sometimes they feel nausea. Nausea is not a big important heart palpitations, unknown fear they feel. They feel suddenly I'm feeling palpitation. Irregular periods, that also will stop. Vaginal dryness, joint aches and pain all the time they're feeling. My aging has started and feeling joint pain. So these are the phases we saw. What is puberty age, then adolescent age, and this menopause age. So every time, even I say that for ladies, so every time it is a new birth, new janma, we call. Like when she herself she takes birth, then puberty time, the new birth, again after marriage, that whatever that deliveries happens, not that child's birth, that mother's birth again, because again new things will start, new hormonal changes, new balances, imbalances, then again menopause. So same with the gents also, that is in males. So why, what we have to do for that? We understood these are the hormones and these hormones are disturbing if it is not balancing correctly. So everyone is having during puberty. uh, 20%, 30%. Some people, some children are having 90%. 20. So if everybody is having some other fluctuations in the that mood swings and physiological, because of physiological changes. So we need, once we understand this is because of hormones is doing, hormones is because of that he's behaving like this, then it is easy to deal with this people, either children, either adults and age people, either this males and females. So what, see, sometimes we don't understand is this, some children, like as I said, some children, they just cry. They sometimes parents also don't understand why they're crying unnecessary. Whenever he's coming, she's coming from the school, crying and telling something all the time, complaining. So sometimes if you are dealing with those children very nicely, telling so many good things and to do this, but they don't understand. So we have some kind of medication for that, those children, because we need to give them, we have to give some supportive treatment for them, because sometimes parents also, they tell, we are so tired to tell these children, don't understand what to deal, how to how to deal with these children. Some children, they just go jumping, doing this, the very violent thing, angry, getting angry violently. They don't understand so many things they're telling, but they don't want to listen anything. So that time they require some kind of medication, some kind of yoga therapy. So that I need to tell, I wanted to tell you. Same with the adults and age also. See, whatever their uh, means, that is like a happy hormones will start creating that time. They are just going because of their work pressure, because of their peer pressure, schooling, college, whichever pressure they're taking very sensitively, and they carry just like this. They don't sleep, so sleeping disorder will start in very earlier stage, like a 30 and 40 may. So then they will go with some other diseases, like they'll suffer with diabetes, BP. So very earlier stage, it starts like a thyroid. Nowadays, the hypothyroidism, hyperthyroidism starts with 8th standard, 9th standard also, girls, boys. So many hormonal imbalances will be. So that time, if we can understand, if we are telling so many things, behavioral therapy we call. So behavioral pattern we have changed. Parents are doing lot of things for their children. They feel, but then even though they are not able to understand their child, understand their adult hey, so then they require some kind of medication. Same with the menopause also. See that it's a regular process, that estrogen will stop here, testosterone will stop, decline. So that regular forgetfulness, hot flushes, all ladies, all these hey, gents, they suffer with this low energy, muscle loss, weight gain, sometimes depression will be there, lack of focus, motivation, decreased motivation. So but if it is increasing day by day, if they are not able to overcome those problems, then they require some kind of medication, some kind of yoga therapy, some kind of exercise, even normal walking. How it works to the brain, how it works to their physiologically organs and this hey, endocrine glands, how it circulates, how it maintain and balances their hormones. So homeopathy's role as a homeopathic doctor, so homeopathy works in a different way. Issues very addressing very holistically. Homeopathy treatment is individualized. As I said, how your child is. If you are able to understand, if you are able to handle your child, it's okay. If you are able to handle yourself, like in adolescent age, then it is okay. Okay, so homeopathy treats the person having a hormonal imbalance. So both physical and emotional problems. So there are many remedies matching hormonal imbalance in homeopathy. Homeopathy works by stimulating the healing power. To produce the healing stimuli, the remedy should cover the holistic picture of the person having the hormonal imbalance. So homeopathy treatment can help alleviate the symptom caused by hormone imbalance. As I said, if you are not able to cope up, if you are not able to overcome, so as well as work to resolve underlying issues. So some of, see, for children, some of the medicine we are having. So how, I'll tell you, I'll explain you about those medicines. See, this is the medicines chamomila, sena. See, we don't have like a direct estrogen hormone therapy. We don't have like this, like a conventional therapist they give. They give direct thyroxine. They give direct eltroxin. So we don't have like this. We have a symptomatic treatment, like a like chamomilla. Chamomilla medicine. How when we give, we understand the symptoms. Like I told, the children with the like how they just crying all the time, like parents, they come and complain about their anger, especially their, they all the time how they become nagging kind of thing. They'll just come behind and telling something, and then otherwise they'll cry, irritable, oversensitive. Means that symptomatically we can understand the changes have started. So we need to give some kind of medication. So which medicine we need to select. So then little bit more things we'll ask, how he sleeps. So then they will tell, okay, during the that they want to keep their souls outside of the particular symptoms, particular they'll mention that. So we need to understand that. So how they wanted to keep their soul outside from the bed. So they'll tell some kind of particular, that is we call PQRS symptoms. So according to that we need to go. Say same Sina medicine. Sina medicine also, all the time they feel hungry. They feel how much ever we are giving different foods item also, he wants to eat. Do not want to be touched, cannot bear. Anybody's house we go, he just cry, he'll start crying. Otherwise, he doesn't want to come. They will complain like this. Same China also. China's medicine also, how it is, they so much sweating will be there. Okay, drenching like this sweating, and he will just sit and dreaming like a castle in the air. So like this, he will come and tell story kind of thing to parents also. So we can understand ki what kind of medicine with that help we can treat our child. So some of the medicines are there. That is a lycopodium, nitromur, pulsatilla. Like as I said, that adolescent age. So in that, that girls are all the time coming and crying, very shy, timid, easily influenced. So parents are also having kind of worry, what to do, how to do. She has to understand, she should not influenced by anybody. So many things they worry about their daughter, either their son. Lycopodium also, intellectual lycopodium actually. But thinking of that like this all the time, they think reading is much nicer than playing football. See how, that is why, see, this adolescent age, he can play, he can go out, he can walk, he can do exercise, but he will just sit and reading. So people also will think how much he's reading, he's so nice, he's really sitting very quietly and all. But how he turns in that bloated tummy, so weak body. So then we need to understand and give the medicine. So nitramur also, how aggressive mood, because of that anger, anxious mood, envious mood, indifference, hatred. Because of that, all the time they are having a headache. They'll complain about headache, sad mood. Silently they're sitting and thinking of, thinking in the mind, and they don't express. But pulsatilla, crying and telling everything what happened, and they just go like this. So this is a, we can think in during adolescent age. So now this is the menopausal we can think. See, menopausal medicine, even ignatia you can give for these children also, who are very sensitive, who are just sitting alone, they don't talk. It is not all the time only crying baby, violent baby, all the time playful baby, hyperactive baby. No, sometimes some children they'll sit 1, 2 hours in one place. Just they don't talk. They're just very sensitive. So these kind of things also. Sometimes any bad news if they listen, so these all the symptoms will worse, and they feel to eat more and more again. They feel better for eating. So Ignatia, Sapia. Sapia lady will be having constitutionally we can understand that hyperpigmentation like a saddle across cheeks and nose. Sad, depressed because estrogen is going to decline, stop. So all the hormones are not supporting. Hypothalamus, then serotonin. If she doesn't work on that, so all the hormones will become go to the negative things. So they don't want to play, they don't want to enjoy, they want to sit in one place. Indifference. Okay, so this is a sapia lady. Then Agnus castus, that is a sterility, inability to concrete child under any circumstance. Because so we need to understand past history, how it will be there. So if they're carrying lot of anxiety, lot of pressure, lot of stress, so they'll go with these conditions. Then Calcarea carp, fatty, chubby lady. Lady either this gents also, that is male. So male, female will be either adults and either even small children also. They are also chubby and all. So different hormones will work. See, like adolescent age, that PCOD will start. That some kind of cyst formation, some kind of thyroid problem. During this children age 9 to 14, just started hormone secretion, but imbalancely very increase more fluctuating kind of thing hormones will start in their body. But in adolescent age, how it goes in that it going to the thyroid, it going to the adrenaline, it going to the pituitary. So it balancing all the time. So they'll eat, and then they become fatty, chubby. So they always tell, don't ask me to do this and this. They'll just sit in one place and eating. So what case I will tell you. These are the medicines, homeopathic medicine I told. What are the hormones? How hormones will inside the body, how it works, if it is imbalancing, how it happens, if it is normal. So normal means what? Children will be anxious in that 9 to 14, not all the children, but all the children in that somehow 5%, 2%, 3%. We need to understand the how is how what type of my child is. So then slowly you can understand, is it fluctuating, is it going imbalancing, is it imbalancing or not. So then according to that you have to behave, you start behaving with it. So one case I wanted to represent with 17-year-old boy, severe pain and swelling in the scrotum when he came to the clinic. So 17 years. So normally 15 to 18 years, that is a torsion. Okay, that is we call severe pain and swelling in the scrotum. Many boys they suffer with that. But the patient had a history of minor trauma because he plays all the time football. So that football injury. So that to scrotum 3 days ago before that severe pain and swelling. He had no fever, no urinary symptoms. But passing urine, he's afraid of passing urine. Sudden onset testicular pain radiating to right side of the groin or lower abdomen. And pain was excruciating. He sharp. He was not able to lie down. He is just sitting with their legs. He was started an antibiotics and painkiller for a month. Ultrasound report, it was showing epididymitis. No GIT complaint, no respiratory complaint, no other complaint. He was not having any past history at all. He has taken 1 month antibiotics and painkillers, but no improvement. But started complaining of gastrointestinal symptoms like acidity, indigestion. Then I have taken mental symptoms. He was telling I'm having lot of anxiety, palpitations, unnecessary. Suddenly it starts some kind of unknown fear I'm having. I'm apprehensive, very impulsive, very sensitive. Am if somebody tells me something, so I'll carry full day like this. So if you consider is acute case, so I've given aconite. I tried aconite, arnica, belladonna, even pulsatilla also I tried because it's very sensitive, even to touch, sharp, dragging pain. That pain wise also and even mentally also. So, but no improvement as such. 20% has reduced. Then again, I went to the deep little bit and to the mental symptoms. So, anxiety, palpitation, apprehensiveness. I saw in argentum nitricum, and I have given to him argentum nitricum 200 for a month, completely cured. So, why I'm telling that age factor, adolescent age has started, torsion has started, football injury that time happened. Already his mentally he was suffering with anxiety, palpitations, unknown fear, apprehensive. So he was suffering with those symptoms also simultaneously. But when it came to him, then he opened up and he told. So that hormones, we don't have directly any hormone is balancing, now you will give a medicine. No, no, we went to this symptomatically, and we considered the mental symptoms because mental symptoms are showing hormonal imbalance. So then I have given argentum nitricum. So this is a homeopathy, how homeopathy works. So now I wanted to explain about yoga therapy role. What we will do with the yoga therapy? See, we if you know homeopathy and simultaneously if you do yoga therapy also, really it works very well. Sometimes some children, some adolescent age people, some menopausal people, they don't require some kind of medication, but sometimes this symptoms they're showing their family member, somebody will tell, no, sometimes she's very moody, sometimes she's crying, sometimes she's disturbing, sometimes she's very good, very happy, he or she. So according to that, either if they understood their symptoms also, so if initial stage they can go with the even yoga therapy, some kind of exercises they can try that. Even though if it is not, they are not able to overcome those problems, those symptoms, even physiologically also, their period problem like a ladies, even this for gents, any kind of motivational things they tell, no, we don't, I don't have motivation. So they'll read lot of books for motivational books even though they don't have. So they can go for exercise, and after that if it's not working, then go for homeopathy also. That is everybody's individual choice. Okay, so what is yoga therapy the role? Yoga spiritual benefits of yoga I wanted to take. Today's healthcare management world, patient safety has increased. All the time they're feeling insecure. Okay, so anybody if you ask them, they feel, they tell feeling insecure. Now so corona has started, covid pandemic, everything. No, but even before that also they're just running, doing so many things also, they're unsatisfied and telling insecurity. The benefits of alternative and complementary medicine have not lost their relevance, being one of the best ways to maintain their physical and mental health is yoga. What is in general? Yoga is associated only with physical exercise? No. But yoga has a broader connotation. It is manifestation of the positive energies of physical and mental health. So, yoga is an effective form of mental or physical healing practiced for many years around the world. In today's world, when our biological clock has changed and the time of sleep and eating has changed, we call lifestyle disorders. So, to maintain a healthy lifestyle, yoga is the panacea for a spiritual, positive, awake, healthy life. So, in this way, we can find yoga as a retreat from our chaotic and chaotic life. So yoga is not only beneficial physically or mentally, but also spiritually. It's called adhyatma, not a religious thing. Yoga is the detoxification process for of our negative thoughts. See what I said. Your 9 to 14 age, that child, if you're telling he is like this only, he does all the time. So you are all the time complaining in front of that child. So negative thought starts from there. It is not suddenly it starts during menopausal and andropausal stage. It starts from that age. So what negative thoughts and the accumulation of positive thoughts cleans the body and mind from accumulated stress and negative impressions. So in general terms, spirituality means living happier. What yoga practice does? Yoga practice and meditation are a powerful combination to enjoy healthy lifestyle. When our troubled mind remains stable, means what? Like as I said, your hormones are started just coming to in your body. Like started developing slowly. Adrenaline started, hypothalamus started create, so releasing some kind of hormones, and there that process in that they are just showing some kind of mental symptoms, psychological symptoms, any physiological symptoms. So that time, how we have to behave? If you started behaving with negatively, then there everything that troubled mind won't remain stable. So then we need to understand and have to deal with those problems. So we feel comfortable and relaxed with this meditation and yoga practice. So spirituality gives you the inner strength to deal with difficult situations and keep smiling. By establishing himself in the being, his inner peace extends outward and makes him a more responsible person, full of love, participation, and love. So, this is the benefits of yoga. So, spirituality we have to add in that, only physical and mental, not. So, what happens during exercise in the brain? See, when you exercise, your endorphins are released during the sensation of pain. Serotonin is released, enhancing your mood. I told that serotonin is the boss kind of thing. If he changes, that he started changing his mood, so everything will change. So everything will affect, like a dopamine. Dopamine is released, improving motivation, focus, and learning. When you normal exercise, walking, whatever, no need to go for anything. If you walk, normal walk, like some now the steps and started everything, that many apps came. So if you do with that, so how it works, norepinephrine is released, improving attention, perception, motivation. So for children, if your availability is there, so you tell them to go for any ground games, okay, instead of sitting in front of laptop. So now, because of pandemic, it is not possible, but after that, so brain derived neurotrophic factor means BDNF is released. What BDNF does? Protecting and repairing neurons from injury and degeneration. See, that's normal exercise. Hormones combine with BDNF, that is brain derived neurotrophic factor, to grow brain cells, regulate mood, and provide mental clarity. Hippocampus. What hippocampus does? When you start walking, either cycling, a part of the brain concerned with the memory. That is what we start in the forgetfulness. So learning, memory grows in size with regular exercise over time. So what kind of asanas, which kind of mudras, meditation we need to do? So Surya Namaskar. So benefits of Surya Namaskar. What are the benefits of Surya Namaskar? It improves blood circulation, promotes weight loss, like in that adults and age, and then menopausal. During that also, because of your hormonal changes, your weight gain, that factor is a more concerning factor. So that promotes weight loss with the Surya Namaskar. Helps regulate the menstrual cycle. Whichever you are suffering with the irregular period during before menopause also, even that 40 after 40 45 also, and even that during puberty time also, that first menses comes that time also. Tones muscles, improves hair and skin quality and memory. So here all the chakras activates, different poses I have shown, because according to the, that individualization how we see in homeopathy, same with the yoga therapy also. According to their symptoms, we need to go for Surya Namaskar. So, Surya Namaskar, in every step, that chakra activation will be there. So, that chakra removes your blockages from those parts, and then it improves your blood circulation, and it activates your hormones. So that's from serotonin to estrogen, serotonin to testosterone, all adrenaline, non-adrenaline, dopamine, all the hormones will balance the thyroid. So some of the asanas are also there with the hormones. See, this is a Gomukhasana. First asana is a Gomukhasana. What it does, when you sit cross legs and holding your hands backside, so you are sitting straight. So here chakra activation will be there. So it is useful for diabetes. For children, it works for stable mind. Ustrasana, it is a hypothyroidism asana. Hyperthyroidism asana means chin release asanas. Who is having hyperthyroidism, they need to do Ustrasana. Here also chakra activation will be. Every asana is also chakra activation. Every time, if you are be in that position for some time, then only activates the chakra. Otherwise, won't activate. Shashankasana, we call rabbit pose. Here also. So these children, they like much more this rabbit pose. If you tell them this is a rabbit pose, they do very happily. See this, they do happily, but their effects are so nice. When your forehead is touching to the floor, that time Ajneya chakra activates. So that is where we put bindi. So that chakra creates happiness. That is the intuition chakra we call, sixth sense chakra. So it is related to memory, forgetfulness. That is, we call it is related to release happy hormones. See, Supta Vajrasana. This is the Supta Avastha. We can see this is a Vajrasana position, but it is going backside. So we are only seeing Vajrasana. This is the Supta Vajrasana. Here also, what happen? This asana is also for hyperthyroidism, where chin release asana. So this asana balances your thyroid, pituitary, where emotions controls. Okay, unnecessary we feeling, unnecessary we are thinking, unnecessary we are becoming so sensitive and impulsive. So we can balance those hormones with this asana. This is a Ardha Matsyendrasana. Ardha Matsyendrasana is also useful for pancreatic hormone. As I said in Gomukhasana, it is useful for pancreatic hormone, that is an insulin hormone. So these are the asanas. It helps do that balancing the hormones. Some of the asanas are also there. Dhanurasana, Bhujangasana. Dhanurasana, Bhujangasana also helps for adrenaline hormone, ghrelin hormone, that is related to stomach. We call ghrelin hormone is a hunger hormone. So you feel hungry all the time, as I said in some drug or medicine also. So, so that controls your hormone, controls that hunger. Same with the Dhanurasana also. This is a hypothyroidism asana. Hypo means this is a chin lock. So who are having this hypothyroidism problem, they can balance their thyroid secretion with this asana. This is a Naukasana. Same like a useful for diabetes also, useful for hypothyroidism. So some of the asanas like for stable mind. Many parents they wanted our child should be stable. So stable minded, for stable mind. Vrukshasana. This tree pose teaches you patience, strengthens the bones of the hips, improves balance, stability, strengthens calmness, relaxes your mind. It is, and it especially it affects central nervous system. Okay, so Vrukshasana, standing on one leg, gives a relaxation your mind, calmness of your mind, and patience. So same with the Natarajasana, Parvatasana. It is a mountain pose. We take for children also, even for adults also. Tadasana. Tadasana is also for teaches patience, calmness, relaxes. That is, see, physiologically also it is useful, like for back strengthening, for this year for improves your stability in the legs. Then weight bearing, that we call weight bearing nature of the pose. So these are the effects also, physiological effects will be there. So pranayamas. Some pranayamas are there. Some meditation part is also there. See, Nadi Shuddhi pranayama, Shitakari pranayama, Shitali pranayama. See, hot flushes during menopause. I told ladies also, gents also, male, females, both of them are having somehow hot flushes. But comparatively, females they suffer more. So, hot for the coolness of their body, they need to do Shitali and Shitakari pranayama. So that is a one technique kind of thing. Shitali means you make a tube and take a breath, inhale and then exhale through nose. Same with the Shitakari, fold your tongue, inhale through mouth, exhale through nose. Nadi Shuddhi pranayama. So in that, this Nadi Shuddhi pranayama, in that all central nervous system chemical reactions will balance, whichever are there. That is a dopamine, GABA, this non-adrenaline, adrenaline. This is gives a calmness of your mind. Nadi Shuddhi pranayama for blood circulation. Brahmari pranayama, it activates and regenerates your cells. Kapalbhati. Kapalbhati is also when you are doing abdominal pumping action, so your white matter regenerates. So your forgetfulness, loss of memory complaint. That many ladies they tell, when I go to in front of the fridge, I'll forget what I want. So small small thing to big things. So white matter regenerates during Kapalbhati. So Kapalbhati is actually direct use is for brain, indirect use is for even because of abdominal pumping action. So all the organs, hormones also will balance. Deep breathing. So slowly inhale and exhale. That is the practice from, I think, Orthodox people. They are doing, like our ancestors also they used to tell, when you are getting angry, count numbers. So here we are telling, take slow breathing, deep breathing, inhale and exhale. So that gives a calmness of your mind. So your hypothalamus, pituitary activities, HPT activities will balance. So some of the relaxation techniques are also there. So relax, like Shavasana, Yoga Nidra, some kind of meditations. That also gives a very calmness and relaxation. So we'll get enough time to balance hormones. Benefits of meditation, that also many of them they know. So if you keep on doing meditation, like a 5 minute, 10 minute as per your schedule, so improves your memory, reduces anxiety, stress, aging will be the slow, improves concentration. So here I showed that is a chakra will activate. So all the chakras will activate, seven chakras, main seven chakras will activate, and then that blockages will remove, and then that all the hormones will balance, and then all positivity will start. So forgiveness, love, compassion, creativity, you feel energetic. So those things will start. So this yoga therapy works on hormonal imbalances, which are balanced in condition, which imbalance with because of our stress, our anxiety. uh, we imbalances our hormones, and then how to treat those people, those children, with homeopathy and yoga therapy. Thank you, Dr. Deepu. Thank you, all participants. Hello.
Hello. Hello. That was wonderful, Dr. Anjali. Uh, and I think Dr. Deepu. Yeah, fine. Uh, I think that was very apt, and you made it very clear how to go about hormonal changes in adolescence, and how to help them overcome those problems, especially for children. And I think the workouts will be very fun as well. Children will love that. And any questions? I will just try to see any questions. Yeah.
Dear participants, if you have any doubts, please.
Yeah. I think it was very clear actually. Now one question, I think I will see. Any medicine suggestions for excessive perspiration, drenching sweats in menopause?
Yeah, yeah,
Yeah,
even I
from
read that. We can give a constitutional medicine also if we easily considered and we can understand the mental symptoms. According to that, we can go. Like a constitutional medicine will be the calcarea carb. But if constitutional is not suiting, then you think about mental symptoms also because it's a menopause. So what symptoms she is having? You need to consider that, like a sepia, pulsatilla, as I said, she's becoming more sensitive and all. Then mental remedy, mental symptom, if you consider that remedy works really good, beautiful, beautiful action will be there. So so particular medicine I cannot tell. So calcarea carb we can give, but calcarea carb is a if you consider constitutional medicine. Otherwise, if you find out the sepia lady she's like this and pulsatilla, so according to that you have to consider. Okay.
okay. Uh, that will help, I think.
Yeah.
Another question by Dr. Nandini Tombre. What are basic yoga poses for female obesity after childbirth?
After childbirth, means after
Childbirth.
delivery.
Yeah, after delivery.
After delivery, immediate, see, normal delivery also, after immediate delivery you should not do anything. After 6 months you need to start, and with the scissor after 1 year. Otherwise, whichever hormones are imbalanced, that will take till 6 months to balance, because we need to feed baby also, so we should not unnecessary disturbs our those hormones. So after 6 months you can start small asanas which are related to that, your whichever pain, back pain, if you are having any kind of, so slowly. And then surya namaskar you have to start later stage, like after 3 months. Once you start, you should not start immediately surya namaskar. Any medicine for hormonal imbalance? Hello.
I think some medicines for AMH imbalance. Any medicine for hormonal imbalance in case of female infertility if
That
anti-Mullerian hormone deficiency.
AMH. So that is that, as I said, na, see, there's just only antimullin hormone if you're seeing and wanted to give. So I would suggest pulsatilla. Okay, but again you need to consider those symptoms also. Why only AMH factor is not a way. You need to consider what kind of her mentality and constitution and her other symptoms also. Is there any pathology behind that? So those symptoms also, and then we need to give medicine. So 3-4 medicines we give normally for AMH factor. Pulsatilla we give, sometimes we give borax also, even bovista also we give, even like because of that, some other FSH, LH, whichever hormones are again showing some kind of either nothing is showing, only AMH is showing. So we will consider this even sepia also, not alone menopausal, for only menopausal. So sepia also we think for that.
Okay. For hamstring pull, varicose veins, love handles, and double chin.
Yeah, see that yoga asked, no? I think yoga poses.
Yeah, yoga.
So that is a Uttan Padasana. I didn't show here, but that is a 90-degree. Both the legs, they have to take 90-degree. That is Uttan Padasana we call. That is very, very good for varicose veins. And if you give some kind of homeopathy medicine like a Homoeopathy and Asculus hip and all, so it really wonderfully it works. Okay, so this Uttan Padasana is a very good for varicose veins. What
Thank you, Dr.
double chin? Double,
Munwar Sheikh.
yeah,
Yeah.
double chin. You can go with the all hyperthyroidism asanas, where is the chin release asanas. So this is the practice actually. So you don't need to massage and all. Those for many ladies they massage that double chin, so they feel that. So but no, instead of massaging, they can go with the Ustrasana, Bhujangasana, as I have shown actually. In
Dr.
some.
Munwar, you can unmute yourself now and you can ask the question. You are a co-host now. Dr. Munwar Sheikh, you can unmute yourself. Yeah.
Yes,
Hello.
yes. Thank you so much for unmuting me, Dr. Deepu. Hello. Am I audible? Hello.
Yeah, yeah.
Yeah. Thank you so much, Dr. Anjali. It was a really, what do I say, very simple yet very informative session that you have really given. And I was very happy to see the kinds of yogasanas and patience with which you have told everything. There were a couple of questions which I had actually, which I think Dr. Deepu has just put across. I was just wanting to understand, like, see, for peripheral vascular disease, we normally use the 90-degree angle pose, lying down on the back and cycling in the air and clockwise and anti-clockwise. That also does help in varicose veins. And halasana also I would suggest. But I just wanted to know your opinion on varicose veins for hamstring pull, for sports injuries, basically when they have that hamstring pull, and for double chin and love handles, because there are a lot of ladies who normally come with that extra deposition of fat, and just to look good and for cosmetic reasons as well. So just was wanting your opinion, Dr. Anjali, on this. So can you please suggest?
Yeah. See, first what you asked me about varicose veins with hamstring pull. Okay. So
Yes.
there you no need to go for that cycling kind of thing. So that
Okay.
will worsen sometimes. So Uttan
Okay.
Padasana also that we tell for only varicose veins. That is both the legs at 90-degree with lying down position.
Right.
But in that
Okay.
with the hamstring pull is there, so they need to do Ekapada Uttan Padasana, only one leg. Okay,
Okay.
and one leg will be the folding position with the folded knee, and one leg
Okay.
should be up. So that is like a 1 minute they need to do, and then slowly they can increase. So one by one leg they have to do. So it is called
Right.
Ekapada Uttan Padasana. And what
Right.
second is a double chin. So double chin, see this is the Ustrasana. Instead of doing massage, Ustrasana helps for double chin. Ustrasana, Supta Vajrasana, Matsyasana.
Okay.
Those
Okay.
asanas helps for double chin. Yes.
Okay.
Yeah.
Okay. 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 Ma'am, for a hamstring pull, that should help, right? Whatever you suggested, right?
Ekapad.
Apart from
Ekapad.
varicose veins. Ekpada has that. Okay. Okay, right.
Yeah.
Okay. Thank you
Because
so much. That was truly informative. Yeah. 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 And what about
because
love handles, ma'am?
hello. Yeah.
Dr. Anjali, about this extra deposit of fat around the waist area or the upper back area. I mean, how do we get rid of that through yoga?
Yeah, see, through yoga, that is Surya Namaskar. If they're having a heavy fat, as I said, see, Surya Namaskar is not, we know only regular Surya Namaskar. So instead
Correct.
of that, here I have shown a lot of poses. So according to that lady's problem, see, like you are telling now waist,
Right.
fat deposition is more, either thighs also many of them.
Yes.
So they're not able to do Ashwasanchalanasana, like a backside leg, taking leg
Correct.
fast. So you have to skip some poses there, and slowly you can take them to that normal Surya Namaskar. So in the beginning, you need to teach according to their problems. And Surya
Okay.
Namaskar will give a shape of the body. Surya
Okay.
Namaskar, yeah, Surya Namaskar is a very good asana. Actually, in that, Surya Namaskar is equal to 5 asanas. So every time you do 5 asanas, actually. Bhujangasana,
Okay.
Parvatasana, Ashwasanchalanasana. So every time you do 5 asanas.
Okay.
So that chakra activation will be there. So your hunger, like I told in stomach, that ghrelin hormone is there. So that will balance very nicely, because ghrelin is the culprit. So he will
Okay.
only provoke to eat something.
Okay. Okay.
So
Okay.
that when you go for Ashtanga Namaskar, coming to the Bhujangasana, going to the Parvatasana, so then
Okay.
so that for thighs deposition and waist deposition, they can skip Ashwasanchalana, means that is taking front side this leg. So they can skip
Wonderful.
that.
Wonderful. Doctor, two more questions. Okay. From the perspective of like people using a lot of laptops and computers now, like with the online thing happening more. So I just want to ask you, like, there are a lot of people who complain about backache and neck pain as well, like cervical spondylosis or cervical strain and lumbar strain as well. So what are the, and sometimes even sciatica. So would you suggest a couple of asanas which they should avoid and not do?
See, if their lifestyle is like this, so then
Correct.
what they have to do when beginning that whatever session they're going to start for sitting for that, there it's on the chair itself they can do neck exercise.
Okay.
Five times, only small neck exercise, and they have to keep it in their mind. After 3 to 4 hours, again they have to repeat that neck exercise. So,
Okay.
because whichever stress is coming on your cervical, that stiffness will go. Then that stiffness will avoid spondylitis.
Correct.
Because of the stiffness only, they'll prone to in that spondylitis things. So
Okay.
they can avoid that. So slow movement make that clockwise, anti-clockwise. They have to do neck exercise every 3 to 4 hours, and that is only three times. Just a fraction of second you require for that. And then
Okay.
sciatica.
Okay.
Sciatica, see, they need to sit for 8 hours and 10 hours. So they on that chair itself they can take backside one pillow, that is in lumbar position mein, and they have to sit with that. And after that, once they come to the normal position, like get out from the chair, they can sit in Vajrasana position, and they can try with the not full position, that just to go for the going for on the elbows, not full Supta Vajrasana. They have to just sit on the leg and
Okay.
slowly take their hands backside, so that whichever stress is
Right.
coming for that lumbar vertebra and that lumbar side, backside, there that they can release with that, because you are doing opposite action.
Okay.
Okay,
Okay.
thank you, Dr. Munmur.
Thank you so much. Thank you so much. That was really useful.
Thank you. Thank you so much. Thank you, Dr. Deepu. Thank you, Dr. Rekha.
Dr. Rekha, can you just leave yeah.
Yeah.
Rekha, Dr.
Yeah.
Rekha.
Hello.
Rekha.
Hello.
Yeah.
Yeah. Dr. Anjali, that was really wonderful. Actually, we can have another session on eye exercises as well. I think we need uh, kids have spectacles in very young age nowadays, so that can be addressed at some point of time. That is my suggestion. Anyway, I think we can thank
Conclude.
Dr. Anjali for the wonderful session, and we hope to have more such wonderful session and on yoga as well. uh, I again and again I will thank all the participants who have been consistently very eager to learn more about homeopathy as well as all the subjects. Thank you all the wonderful participants. Thank you for your questions as well. And again, Dr. Deepu, I think we can wind up.
Yes, yes, ma'am. And
Yes.
thank you, Dr. Anjali, ma'am. Actually, you can ask me for any time, and we are also eager to learn. When she asked me, I just, yeah, I was open to. I am open to every doctors, because even nowadays I think it is our 200 plus webinar right now, I think.
Oh
Yeah,
So
God.
yeah.
even and we have some
Successfully.
sincere followers, sincere. Like I can even remember there is a group sir and Dr. Surya from Kollam, and so many people. Actually, these people are here. They are from the last time. There is Olga from Bulgaria. She's I think she used to attend every program. I think from the beginning of Hope. So
Oh,
we thank all the doctors. Actually, we are going to conclude by this week. So thank you so much for joining us, and thank you, Anjali ma'am, and thank you, Dr. Rekha, for coordinating the session excellently. Actually, I have a program in with my chapter as well, so I'm not able to see the initial part, but I will definitely see it later in my YouTube and Facebook. So thank you, everyone, once again, and good night.
thank you. Thank you.
Good night. Yeah.